Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Receptors. Serotonergic receptors are of 7 types. 1, 2, 3, 4 to 7 types. So 5-HT1. This 5-HT1 is again divided into 5-HT, 1A, 1B, 1C and 1D, 1E, 1F and 1P. There is no 1C. 5-HT, 1A, 1B, 1D, 1E, 1F, 1P. 5-HT1C is called as 5-HT2. This 5-HT1 is a G protein coupled reaction which is GI type, which decreases the cyclic AMP. It is present in the brain and enteric nervous system mainly. Then it is an autoreceptor. Because it is an autoreceptor, it inhibits the serotonergic neurological activity in the brain. So 5-HT, mainly 5-HT1A. 1A is present in raphe nucleus of the brain and also hippocampus. Because it is present in the raphe nucleus in the brain and hippocampus, it is mainly acted by the drug buspirone. Buspirone acts on 5-HT1A receptors on the raphe nucleus and hippocampus, whereas 5-HT1B and 1D, it will constrict the cranial blood vessels and inhibits the inflammatory release of neuropeptides in them. So this 5-HT1B1D acts through this 5-HT1B1D. Sumatriptan is the drug which acts, and it is used in the pathogenesis of migraine. It is this 5-HT1 is also used in the pathogenesis of constipation also. This is 5-HT1.
thank you and thank you for watching.